Good afternoon. My name is Athena Green. I will be doing my video on inserting an intermittent urinary catheter on a female, which in other words is straight cath. So the first thing is to gather all your supplies. And so we have disposable gloves, the drape, my hand sanitizer, the surgical gloves, sterile surgical gloves, and the urinary catheter kit, and the peri wipes for the patient, and a towel or washcloth, whichever you have. And so next I would verbalize the order to make sure that the order is right from the doctor, and I would ask the patient if they are allergic to any medications or betadine, because that's what we're using, or any kind of lubricant. So, good evening, Ms. Doe. Your doctor, Dr. Hung, wanted us to insert a urinary catheter, which is a straight cath, to help get the urine out of your bladder. Can you please let me know if you have any known allergies with any betadine or lubricant that you know of, or any medications? So the patient says no, and there's no known drug allergies. And so next, can you please let me know what your name and date of birth is? And the patient states the name and date of birth. And so I've also checked on the ID band, and it says Jane Doe, 09/28/1972, no known drug allergies. And so next, we're gonna clean our hands with hand sanitizer. And don on the disposable gloves, because we're going to get our patient ready. So we will have our patient lay down in the supine position and place the towel underneath the patient. And then we will ask, if it's a female, for them to hold their legs to each side, the right and the left side, and rotate them out so that we can see the meatus and the perineum. Leave the perineum area open. Here's a drape. We would drape over the top of the patient. It would be in a diamond shape, but that's not what we have in the kit, so I'm using a drape. I know that it would be in a diamond position. So I'm going to explain to Ms. Doe. Ms. Doe, I will be putting in the urinary catheter, and let her know if she feels any discomfort, because she's going to feel pressure from the catheter going in, that she should take slow, deep breaths while it's going in. And just let me know how she's feeling while it's all going on. And so we go from there. And then after that, we are going to, I have my biohazard right here, bag right here. So we are going to clean the perineum area with the wipes. I have a couple of wipes here. So we will clean the right side, the left side, and the middle. And then we will take our gloves off after we do that, because next, close this, because next we're going to get our sterile fill ready. And we're gonna our stuff right here. I'll put on another pair of disposable gloves and open that up. But don't touch the sterile stuff inside. Leave the sterile gloves for later to open. And we're going to read that and make sure that our urinary catheter kit is not expired, and it says 10/31/2020, so it's still good. And we have our swab sticks, our catheter 14 French, our wrap, label, the poly bag, sterile water syringe, and our towel we have. And then so we're gonna open it. I know it's not perfect, but I practice with this, so I can just sit this on the thing right here on the edge. Open up from side to side, down. Sterile glove right here. Take the sterile glove out. Don't touch the inside of there. Leave it in that field. I'm going to take this off. And I'm going to hand wash again with my sanitizer. So now I'm going to put on my sterile gloves and start the procedure. And you will just want to touch the outside of the creases as to not mess up your sterile field. And I will start with my dominant hand, which is my right hand, to get the glove on. Hold just a tip. Put it on. And then go under the cuff for the next one. Okay. And so as you can see, I have the drape right here. This drape will go with the shiny side down. So it will be sitting right here underneath the patient. And then we're going to get the rest of our stuff together. So first, get our swabs together. Open those. Put them in our sterile field right there. And we have the lube right here in the tube. So I just move this to the side. Put it right here on the side so we can get to it. And then next, we're going to take out our intermittent cath. And you're going to kind of like wind this around. Because basically, if we have any specimen, we will put the specimen cup at the bottom so it stays sterile. But this tray right here goes right underneath the client where the urine will flow out at. All right. And so I'm just gonna put this in here and put the lubricant on it. Leave that right there. And we're gonna start our procedure. All right. All right, Ms. Doe, we're gonna start the procedure. I am gonna put in your straight cath. And so you will start by holding the left and the right side of the labias out and open so you can see the meatus. And I'll take my swab stick. One time on the right side, once on the left, and then the last one going straight down in the middle to make sure the area is clean. next, we're gonna take this and make sure there's enough lubricant on it. And this bottom end can go in, because all of this is sterile, in the tray. And I will stand up. And Ms. Doe, I am going to be inserting the catheter. You might feel a little bit of pressure, so take nice deep breaths. And we will push it in 1 to 2 inches till you see it giving you a flashback of urine. And then once it does, we'll hold it and let it fill up, because this basin right here has measurements on it, so we'll know how much it fills up. If we need to get a specimen, we will be trying to get it now, but that's not part of my packet. Are you doing okay, Ms. Doe? And she's not saying that she's having any discomfort. And so now it's done. So I would pull back a little bit, and we're almost done. There you go. And then you just pinch the part of the straight cath, because there could be some leftover urine in there, and you would place it in the garbage. We just bring our basin up to the point where we can see, measure it, keep that in our head, because we're gonna need to document that later. And I will proceed to pour this in the toilet, in the patient's toilet, and keep those measurements in my head. So that would be trash, and then this would be trash. So clean our area up. This would be trash. We're gonna remove our towel. Well, leave our towel right there right now, because I'm gonna take these gloves off, throwing off the gloves. Throw them away. And we're gonna wash our hands again. It's all about the hand hygiene. Gotta stay clean. And now we're gonna put on another pair of disposable gloves. All right, Ms. Doe, we're done with the straight cath. Now I'm gonna clean you up and position you comfortably. So our patient is still sitting there. We will get the peri wipe and clean the area that we already used, the area that we just got finished doing. So you would just wipe one side, the other side, and then down the middle. Make sure you get all the excess betadine off, because you don't want it on there. And then the towel will go in her hamper that they have normally in the rooms, wherever that would be. So we're gonna act like it's right there, and just take the drape off. All right, Miss Doe, you can place your legs back in your regular position down, and don't have to hold them open anymore. You will sit the head of bed up if you can for your patient, and take these off. These are not good anymore. That's garbage. Wash your hands again, and ask your patient, Ms. Doe, is there anything else that you need? If she tells us she's having any pain or anything, we notate that. We're gonna notate that, and then we would ask her, does she want her curtain open or closed? And it's either that she wants. So after all of that is done, you will go to your computer, you will document the date and time that the straight cath is done, and the size catheter we used, if she had any symptoms that she said that she had, any type of pain or anything like that. And then after that, that would be it. Also in the documentation, we will record the amount, how much of her output that she put out on the intake and output part of the screen in the EMR. And we will also put if there was any blood present, any mucus present, and so on and so forth. Okay, so I watched my video and it cut off the part just before I put my patient in position to pull the privacy curtain